Hi there, it's Dr. Owenz talking to you about dialectical behavior therapy skills. And today our focus is on opposite action. So just a quick backup. Remember that dialectical behavior therapy has 4 modules or buckets of different types of skills. The first one really shouldn't be a bucket. It's like a backbone of all of DBT. And that's mindfulness, which is being aware of the present moment. Without judgment, right? Seeing things as they are. From there, we talked a little bit about already, previous videos, about distress tolerance, which is learning to tolerate intense amounts of distress, like an 8 or 9 out of 10, without making the situation worse. So we're not solving the problem or changing our emotion, but we're just learning to tolerate high intensity emotions. The third bucket is emotion regulation, which is understanding our emotions, reducing our vulnerability to negative emotions, and learning how to change our emotions when they're not serving us well, right? And then the fourth module or bucket of skills in dialectical behavior therapy is interpersonal effectiveness, which is how do we get our needs met while also maintaining our relationships, increasing our own self-respect, and the way that we communicate with respect to other people. So today we're talking about the skill of opposite action, which falls into emotion regulation. So emotion regulation in DBT is a skill set for when it would make sense to kind of regulate our expression of the emotion. Maybe we want to reduce the intensity of it. Maybe we need to shift or change an emotion. Maybe we need to reduce our vulnerability to negative emotions. So it's about managing the emotions that we do feel, how we experience them, and shifting our emotions when they're no longer helpful. So of course, all of our emotions serve a purpose, right? We might become angry because somebody violated our rights. But there's also times when we become angry and we're kind of stuck being angry and it doesn't serve us anymore. So emotion regulation is, what do you do when you recognized an emotion, you've expressed it appropriately, if that fit the situation, but you're still kind of stuck, right? Your body is still quite activated. Your thoughts are still quite angry or anxious. And it would really serve you to be able to shift your emotional experience there. Right? So emotion regulation has several steps. One, you have to be able to identify your emotion. And that's why mindfulness is the backbone here, right? Because that ability to recognize what's going on in our bodies and our minds, and then say, hey, you know what? This is anger I'm feeling, or this is worry. Two, we have to increase our emotional intelligence in order to regulate our emotions. So understand what emotions do for you, right? Like, what does worry do for you? What does sadness do for you? What does anger do for you? So emotion regulation is not just about not caring why we have an emotion, just trying to change things we don't like. It really comes from this deeper place of awareness and understanding of the purpose of emotions, right? So I might be feeling angry because my rights were violated. I might be feeling scared because something is threatening to me, right? 3, we use emotion regulation to stop unwanted emotions before they start. 4, to change painful emotions once they have started, right? But remember, emotion regulation acknowledges emotions are not good or bad, right? We don't only want joy or happiness in DBT or excitement. All emotions have a purpose. Also, we understand that we're not trying to suppress an emotion, like, oh my God, that's anger, I can't feel that, let me shove it down, right? We understand that suppression of emotions actually can make things worse. There's a fair amount of research on that. So we're recognizing the emotion, understanding the purpose, and then choosing to use opposite action if in fact it would serve us to shift our emotional experience. Emotion regulation is really only for ineffective emotions. There are times when anger is effective, when worry is effective, even when sadness is effective. So this is when our emotions are ineffective or maybe don't match our experience or are hanging on for too long. Let me just say that DBT has no shortage of emotion regulation skills. There's the stop skills for emotion, please skills, riding the emotional wave skills, activity scheduling, checking the facts, affirmations, and opposite action, among a few. So this video just covers opposite action, and there's lots of other emotion regulation strategies that can be used in DBT. There's kind of 3 basic ways to change unwanted emotions. The first is to check the facts. This is traditional cognitive behavioral therapy. In cognitive behavioral therapy, we learn to analyze our thoughts a little bit, to see if the facts fit our emotional experience. But sometimes the facts do fit our emotional experience, right? Maybe it makes sense to be sad if we've lost a loved one. But now that sadness is preventing us from taking care of our kids or going to work or other things that are starting to make our situation worse. So we can check the facts, and if the facts don't fit the situation, that can help us with emotion regulation. Alternatively, we can problem solve, right? So we can, go through a series of steps to resolve a situation. Or third, we can utilize opposite action. And so opposite action is about behaving the opposite of the urge that's associated with a particular emotion, right? So we already said anger, the urge associated with anger is attack, verbal or otherwise. The behavior associated with fear is avoidance, hiding, getting away, right? And so this requires us to recall the cognitive triad, right? Which is the ways in which our emotions and our behaviors and our thoughts are all linked. And this comes from cognitive behavioral therapy, right? So what we think affects how we act and feel, right? Those are our thoughts. Our behavior, how we act, affects how we think and feel. And then our emotions, what we feel, affects how we think and behave. So these 3 things, they're linked. That means that we can intervene at any point. We can intervene with checking the facts for our thoughts. And if we change our thoughts, that changes our feelings and our behaviors, the other 2 pieces of the triangle. If we change our feelings, that affects our behavior and our thoughts. So here we're changing our behavior, which will therefore affect our thinking and our feeling experience, okay? When do you use opposite action? Because for every DBT skill, there's kind of appropriate uses of it and inappropriate uses of it. So one, as I said before, when knowing the facts doesn't seem to work, right? So I know the facts of this situation. I maybe know I'm inappropriately angry, but I'm still inappropriately angry. Or I know the facts, and the facts kind of fit in some ways. I'm sad because of a breakup or because of a loss, right? But the sadness is extending for too long, and it, I recognize it, I felt it, and I also need to get out of bed. 2, when the emotion, sort of its intensity or its duration, is just not justified by the situation, then opposite action fits here, okay? Or thirdly, when you're avoiding what needs to be done, which was my example there about grief and loss. So we know that emotions lead to behaviors, right? I'm angry, so I'm yelling at someone. I'm scared, so I'm avoiding a situation. If we know that's true, then we know that the opposite is true as well. Behavior leads to emotions. You've likely experienced this. Maybe you felt sick just a little bit, not feverish and everything, but I've got a cold and I'm not feeling great. But I'm going to buck up and go to work because I need to for whatever reason. And when you were at home, you were so sluggish and on the couch. And when you got to work and you started to behave in the way that was required at work, then you also started to feel better. And you're I don't feel quite so sick anymore. Same thing, you work in customer service and you're feeling a little down or depressed, but you have to go and put a smile on your face. And then you notice you feel a little bit better. In part, your work distracted you, but also you are using opposite action. Opposite action can, to some people, sound simplistic. I'll just act opposite the way you feel. So the question, is this a valid strategy for dealing with emotions, comes up. And here's the thing, most effective treatments, DBT aside, for emotional disorders, do ask a client to understand the opposite of their emotional experience and to act opposite to treat things. Let me give you some examples. The first is behavioral activation. Behavioral activation is an evidence-based treatment for depression, and it involves doing the opposite of what depression makes people want to do, which is, depression makes people feel a lack of motivation, a lack of pleasure, difficulty initiating tasks, a lot of avoidance and rumination. Behavioral activation is about positive activity scheduling movement, and physical activity throughout the day, as well as social experiences. That's the opposite. It's acting opposite. Exposure-based treatment for anxiety, like interoceptive exposure for panic attacks, or a hierarchy of avoided situations for generalized anxiety disorder, and then facing them with support and the ability to relax one's nervous system. Those are two well-validated treatments for anxiety that ask people to act the opposite of how anxiety encourages them to act. And then effective treatments for anger. Almost all of them require people to recognize their urges associated with anger, the triggers, and then to act opposite, right? To engage in a variety of strategies, deep breathing, helpfulness, that kind of are the opposite of the anger urges, to eliminate that emotion. So when you're going to engage in opposite action, that question, is the emotion justified, is where you start. If you're in a classroom, and for some reason there's a lion in the classroom, and you feel like, I'm going to hide or climb out the window because I feel scared, then the emotion is perfectly in line with the situation, and we don't want to use opposite action. We do actually want to go with that emotion of fear. But if you're in a classroom and you need to talk to a professor about an assignment, some questions that you have, and you feel like the professor is a lion, you're as scared of them as you might be of a lion, then maybe the emotion's not justified. And so it's not helpful for you. And so you do need to use opposite action so you can meet your goals, right? So let's kind of do a really brief practice exercise. You can close your eyes if you like. Take a big deep breath and think of a time in the last 7 days when you felt quite angry. Maybe you're angry at a partner, a work colleague. When you've got that situation in mind, try to envision yourself as really there. Like, let your body activate this anger. Imagine what that person is saying to you, why you feel it's unjustified, why you want to defend yourself. Imagine the scenario around you, what you're seeing or hearing, what's going on. And now I'd like you to take your hands, unfurl your fingers, lay your hands palm up on your lap. Relax your face, smoothing out your brow, and give yourself a little bit of a half smile. Breathe into that position. That's just a tiny bit of opposite action, using half smiling and willing hands. And it shifts anger just a little bit. Changing our facial expression can shift our emotional experience. So like all DBT, like radical acceptance, you have to go big or go home. So you're not, when you do opposite action, you're doing opposite behavior, opposite words and thinking, opposite facial expression, voice, tone, and posture. You're really faking it until you make it. So if you're scared of going to a party due to a social phobia, you don't go and then sit in the corner, right? Opposite action is going, starting a conversation with perhaps two different people, smiling throughout that conversation, and speaking confidently, in a kind of Superman pose, really going all the way with that opposite action. So there's 7 steps of opposite action because we really partialize out each behavior in DBT. The first step is, what's the emotion I'm feeling? I don't know how to act opposite if I don't know what the emotion is. So I got to identify, oh, this is fear, or this is anxiety, or this is sadness, or this is anger, or this is frustration, or this is exhaustion, whatever it may be. Then you have to use your emotional intelligence to identify what urges match that particular emotion. Sad, I feel like staying in. If I'm scared, I feel like avoiding. And if I'm angry, I feel like attacking. 3, ask yourself, does this emotion fit the facts? Will it be helpful to me? 4, do I want to change this emotion? Right? If yes, I need to determine what the opposite action is. Now I've decided I'm going to do opposite action. So the 6th step is do that opposite action all the way. And then 7, continue to repeat that opposite action until the situation is resolved. So your homework to try this skill this week is to find one time when you're experiencing an emotion that perhaps doesn't fit the facts, isn't justified, and it would be useful to you to be able to shift your emotional experience. Identify the emotion, identify the urge associated with it, identify what would be the opposite action. Give it a try and see what it does for your emotional experience. Thanks for listening.